Good afternoon, everybody. It always takes a little longer than I think it's going to log into Microsoft Teams. So I'm see people are still trickling in. I'm going to give people a couple more minutes before we get started, but not too long because we do have quite a bit to cover today. In addition, the primary reason that we are doing this so soon is so that we can record this meeting, and it is being recorded. And we will then send everyone the link to where it's posted so that people can maybe go through this on their own time in bite-sized chunks. So we'll get started in about 2 minutes. All right, so people are still trickling in, but we do have a lot to cover today, so I'm going to get started. I know I promised last week that these webinars that we're doing now are going to be in bite-sized chunks, and so we were hoping that they'll be a whole shorter and more easy to uh, dig out and address the specific concerns of specific areas. But this one is not. This is very long. Um, I don't want to keep you too long on a Friday afternoon, so we're going to get started. And as I said, this is being recorded, and we will post this entire presentation online as soon as we get it cleaned up and prepared and so on. So probably early next week. So if anyone comes in late and misses the beginning, it will be there for you to peruse. So before we get into the meat of the enrollment webinar, I just want to cover a couple housekeeping points. Please stay on mute for the presentation. If you have questions, you can put them in the chat and we'll look through that at the end. Either we can address it then or we can incorporate that in messaging that goes out to everybody later. Um, so I did this webinar, something very similar, almost a year ago. And so the other housekeeping point that I want to cover so that everyone is on the same page about this is that last year people left because they said this doesn't have anything to do with us. He's talking about schoolment, and we don't use that for enrollment. So to be clear, yes, you do. Nobody told you that you could use any other system for enrollment, including pen and paper. And if you have PFA and PI funding, that's funding that comes through the Chicago Public Schools district. And so you can't just be enrolled in DFSS systems. In order to have children actually enrolled in that funding stream, they have to be in the Aspen system, which is the CPS enrollment, attendance, grades, and everything data system. You're probably familiar with Aspen already if you have children in Chicago Public Schools. Um, so we don't have access to input anything into Aspen because we are not Chicago Public Schools employees. So the only way we can get children into their enrollment system is through schoolmint. It's going to determine what they've been enrolled in and give them their CPS ID, and create their permanent file at CPS and so on. So if you have children that haven't come through schoolmint, don't have a CPS ID, they're not enrolled in PFA or PI. There will be no record that they ever existed. The count that the mayor gets, the count that the governor gets, and so on, does not include those children. So everyone uses schoolmint now. Now I know it's an annoying system. So does CPS, and next year there will be a new vendor. I know there'll be more learning curve there, but hopefully some of the problems that people encounter using schoolmint will not occur in the new system. So they're in the fairly early stages of designing that now. I've been to a couple of meetings, and I'm hopeful that we'll have a better system next year. So that's the end of the housekeeping. Here we go. So it's a new program year, 2024 to 2025. Everyone at this point should be in CSD Cares. Um, Now you're looking at a screenshot of the dashboard right now. You see you've got the user portal, you've got the ServiceNow ticket system. Those are actually the big pieces. You've got schoolmint. If you still don't have the right access, you need to get it because you need to be in there now. And for better or worse, it's not me. So I used to control, access, manage user accounts in COPA, but I do not do so in CSD Cares. That's because access to CSD Cares is through this dashboard software, which is a different vendor even. It's not Salesforce and it's not Schoolmint, it's somebody else. So access to all of the systems can come through that portal. And so you need to get in touch with IT to do that. And the way you do that is eventually to start a ticket. But I know you're saying, if I can't get into CSD Cares, how do I start a ticket? The answer is we gave out the road to access last month at the directors meeting, actually yesterday also at the directors meeting. It's got little QR codes that can take you to different routes to fill out forms and get started with updating access, getting your password back, whatever it is that you need. That's not in the slide now, but before I send this presentation out to everybody as a PDF, I think I'm going to add a screen right here that has the road to access. So then you'll just be able to pull up this presentation with and take your phone and take a picture of the QR and find the website. Okay. So our expectation this year is that all children will be enrolled in CSD Cares, and then we'll have funding attached. That means kids won't just be enrolled at the center or enrolled in a class, but they will have a funding type attached. And so we will be able to report on children and enrollment at the grant level. New children will only be added through schoolmint. There's no other way to put children in here except if you're using CCAP only children. But even in that case, if they become no longer CCAP only but want to enroll in another program, they have to go through schoolmint. Attendance needs to be taken daily for center-based children. We are getting increasingly strident demands from our government bodies and our funders at the city, at the state, at the feds to report on attendance, which means you need to put attendance in. Otherwise, we'll be filling out attendance sheets in Excel forever. So we just need it in CARES, and then we can run the report and we'll be fine. All the documentation we need needs to be in quickly. It needs to be accurate. We're supposed to have information in within 30 days or 45 days or 90 days. We need to hit those marks. Um, so we're not really rolling, I know this is what I put on the screen, but we're not really rolling out new modules right now because pretty much everything exists in CARES at this point. However, we are working on adding new reporting capacity and streamlining and getting rid of some of the issues that we have. So we will periodically have new training out. Materials in the knowledge base are updated on a regular basis. There's still new pieces being developed. So continue to look in there to see what's new and what new training information is in there. We want you to try. Okay, try to implement the things. It might not work, but if it doesn't work, do not throw up your hands. Instead, ask for help. And we are working on getting in touch with everybody and helping you through the process of getting into the new system and fully using it. Okay, so what are we talking about today? We're talking about CSD cares, but there are really two pieces to it. The first piece is School Mint, which is designed as an uh, external facing application that is an extension of the Go CPS system that CPS uses for children to register for schools. Um, so that's their concept is that parents are applying online, they're searching, they're researching programs online, they're submitting their application before they do anything else. I know that in the community-based environment, that's not really true. And often parents explore programs by knocking on the front door and meeting with someone and asking to see the classroom and so on. Um, and then they're registering in person. So when that happens, applying in school falls to agency staff, and we'll cover that. The second part is CSD Cares. We're going to go through the various parts of the enrollment process. So we talk about the program enrollment, the funding enrollment, generating the ISB history, uh, enrollment in classes and groups, taking attendance, and how to drop a child. So the lifespan of the enrollment process here. So Schoolment. Schoolment, as I said, is a CPS vendor. Beginning with the fall of 2022, we moved away from our old online application, which was connected to the COPA system, to the new one, which is, again, part of GoCPS. CPS wanted this because they wanted to be able to automatically register children in their own system. And they want, as a result of that, to be able to know which children have been in preschool previously when they arrive in kindergarten. So it's trying to connect the early childhood system more closely with the elementary school system. Okay. So we're going to talk about enrollment. Yes, your home visiting program needs to use Schoolment for enrollment. No, you can't keep using paper. What we've had the last couple of years is we've had a large number of students who were served by programs, who were visiting, and who did not count. They never had an ID. They never counted as being enrolled. There is no record in the CPS system that they were served. And the result is that the mayor's office and the governor's office have people working there who believe that we don't have any children, and so they should fund different things instead of us. So we need to prove that we have children, and the only way to do that they'll be convinced by is telling them who they are. So we need them in our system with names and birth dates and IDs, all the other records that are required. Okay. So the biggest question that we get about schoolmint is parents have applied, or we have applied, and all the kids are waitlisted. We're not getting offers. Um, that's something that started the first day that we went live with this program, and the last time I dealt with that was about an hour ago. So is this a big problem? Um, so the answer is actually pretty simple. This is a good place to start as any, because this is the first place that you're going to interact with Schoolmint is you're going to log into it and look to see who has applied. And you're going to run into the fact that a bunch of people have applied and they're waitlisted. So there's a couple of reasons, but they're all really the same reason. And the reason kids are waitlisted is that there isn't a spot for them. So the first reason is Schoolmint shows that the site is full. And the reason this is common is that when an offer is given in the Schoolmint system, and what happens is when someone applies, they are evaluated for eligibility in the seats that the agency has put out. And if they're eligible for a seat that is not occupied, then they're given an offer. And once that happens, right now they really don't even time out. So if the offer has been made, the child is holding a seat until it's declined. Um, so many people's waiting list is full of children who applied but never came, or who used to be enrolled and left. And in both of those cases, at some point, the seat needs to be declined. And until that happens, the child is still taking a seat. So to decline offers and to get to the whole list of who's been offered, who's been waitlisted, who is not offered, and all of that, you go to the Applications tab in Schoolmint, click on Applications, and then you click on the View Results and Options. I realize this is review for most people. But again, we're posting this permanently, so new folks eventually will watch this too. If you can't see this link, right, you'll go to the box on the application view that says apply, save view. Just select standard view. Um, you can also filter it in any way. And as soon as the screen with children's names comes up, you'll see the view results and options link. So that screen is going to show you who has been offered, what the status is. So for recent applicants, they're just going to be there will be two boxes on the screen. The box on top is called offers, and you've got student names and what their status is. So if they've been given an offer, but they are not attending your program, again, either they were given an offer but didn't accept it, never came in, you couldn't reach them, or else they were enrolled and have left, because Schoolmint does not automatically drop children when they're dropped from CSD Cares. So in any of those circumstances, you need to press decline. That sounds simple enough until you look in the system and see that most people in the system are not in that box. They're in a section where you scroll down and it says all applicants. So after you have reviewed and confirmed someone's documentation in Schoolmint, it takes them off of the list that hits you right when you come in to the site, which is convenient if you're looking for new kids in particular, but it means that it's hidden the decline box. So, as unintuitive as this is, you want to go down to the verification section. So when you see the list of children, um, on the far right, there's a little box that says details and notes. You'll go into that box and then uncheck verification complete and reload the screen. And this will bring them up to the top and you can decline. Second reason that children aren't coming in from school, man, is that the site has vacancies, but the applicants don't qualify for the available seats. So what I mean by that, now we're getting really into the meat of it, is as a provider, you need to set up your seats in Schoolman to reflect the children that you need. In other words, the children that you're funded to serve. So that your funding sources have eligibility requirements, and you need to make sure that children meet them, but you don't want to be overly restrictive and turn away people who are eligible for seats that you have. So starting from the same place, starting from the list of applicants in Schoolmint, you go again to view results and options, and this time you'll select the capacity results, the second option. So this is what we're talking about when we say allocating your seats. You see there's 5 different levels. They are, and this was my fault, poorly named, but there are 5 different levels of eligibility. And you are able to put a certain number of seats at each level. The reason you would do that is you may have, for example, both Head Start and Preschool for All seats at the same center. So that the eligibility requirement for Head Start is essentially 100% poverty or below. Preschool for All is 400%. So there are plenty of kids who can apply, and who can be given a seat for Preschool for All who don't qualify for Head Start. So you would put different numbers of seats. You would restrict certain seats for more needy children while leaving the other ones available for a wider population. And in order to change that, if you look at this and the seats are not laid out correctly, you just click on the pencil there and change the numbers. You want to make sure that the total doesn't exceed your capacity, though, because what you do not want is to turn away families who have been given an offer, because that is bad PR. So each line represents the number of seats at each level. Level 1, which we call categorical, is for children who are determined to be eligible before you even look at their income. So they're homeless, they're foster children, they're receiving public assistance. And those are categorical eligibility uh, categories. For PFA and PI, there's an additional categorical eligibility, which is having a disability. So children with IEPs or IFSPs are what you call categorically eligible for PFA and PI, regardless of family income. So please note that when we started doing this, the the eligibility level for PFA and PI was only 200% of federal poverty, but that has been raised under our more recent intergovernmental agreements with CPS. So you can take more children into those seats. And just be aware that that doesn't make them eligible for Head Start. It doesn't make them eligible for CCAP. It just makes them eligible for PFA or PI funding. So because of that, you may want to still restrict some seats for more needy children who are going to be dually funded while allowing others to be at that 400% level, which is level 4. So the question I had today from somebody was, we have a lot of applicants, but they're waitlisted, and we have vacant seats. Why is that happening? And the answer was they were coming in, these were families coming in about 250% of federal poverty, so they were perfectly eligible for PFA. But that's not the line that those seats were placed on. Okay. So again, you click the um, pencil, you can change the number of seats at each level of eligibility to allow or restrict different families from being given offers. Um, this doesn't take place instantly. What it does is it sends me spam, and then I go in and I approve. That's something that CPS insisted on. I don't believe I've ever not approved a request, maybe once. Okay. So another less common reason is that the application is missing information. Sometimes it has been possible to put uh, children in and complete the application without submitting an income record. However, the income record is required. Even if it's no income, you need to submit a record that says no income. This cannot be left blank. Um, in addition, um, the school system does not understand special characters. As you've noticed, if you try to put in somebody's name with an accent on it and it came out with a question mark, the same thing happens right here in income. So when you put the income amount in, do not use a comma. It will display the result with a comma, but it doesn't understand commas. So if you put a comma in, it won't know the income and they won't get any income points. So just be aware of that law in the system. Again, these little things are part of why we're going with a new system next year. If an application has been submitted and the information is wrong, if you can't access it to correct it, you or the parent may need to call the CEL Family Support Hotline, and the hotline workers have a special access that they can change more things in a submitted application than the rest of us can. So once you've got your slots set up and you've accepted the people that you can accept, you need to go in and put the rest of the kids in. So even if the child is sitting in your room, has been with your program for years, but they haven't applied through Schoolment, they need to do that at least once. There's no other way to get new children in and get them an ID. So the parent can submit one, but you can submit one too. There are detailed instructions in, it still says the digital hub, but you should go to the ServiceNow knowledge base at this point because there is new updated trainings. There are kind of walkthroughs, there are little videos, all kinds of things. There's a lot of really useful information there, and I recommend that everyone poke around at least once a week for a few minutes just to see if there's anything new. The parent doesn't have an account. That's almost preferable. You need to log out as yourself, and then you can just make an account as a parent. That looks like this. Um, you need to you need an email address or a phone number or both. You need to put the parent's information in, not your own. The system gets strange if the same person submits too many applications because it reads all of the submissions as siblings and starts to say there's no way this child has 50 siblings, so then the applications stop coming across. So you need a new account for every family, whether they make it or you do, and then give them the application information once that's done. Um, so again, you're going to put the parent's name in, email address, or phone number. You have to accept some form of communication, either the SMS text notifications or email notifications, because what's going to happen is when an offer is made, the system will either text or send an email to the parent saying you have an offer and with a link so that they can go and accept or decline the offer. Once you've created the account, you need to then add a child. So if you're putting in someone that is already with you, you should find out if they have an ID already. Because if they do have a CPS ID, you know what that is. When you enter it in here, it'll come up with the child's name and birth date and other basic information automatically, which is preferable to creating another one. Because first of all, you don't really want a duplicate account in there. That causes problem. But secondly, if those things are different, if you put the same child in but spell the name differently or give them a slightly different birth date, this CPS will think they're two different people, and then those things will have to be reconciled in the future at some time, which is a lot of work for somebody. Okay. But once the child has been added, it's not over. So when we say put your kids in schoolment, it's shorthand. We really mean put your kids in schoolment and submit an application. So once they're in, there'll be a box on the front page and it will say add applications. If there were applications, they'd be in little boxes on the screen here, but there aren't any. So you can apply to up to 5 sites. Although if you're putting them in, you're going to probably only do your own. So you just click on that plus there and then start. It'll ask you the questions, just fill them out, demographic information, family size, family income, and then it'll ask you to pick sites to apply to and submit. So it's clunky because there are a number of screens to go through, but there's nothing particularly complicated about it. So once that happens, though, you put them in. If they're eligible for a slot, they'll be given an offer. Um, maybe sooner, but definitely overnight. But at that point, nothing will happen beyond that. So once their application is in and they've been offered, someone needs to go and accept. Either the parent can reply to the email or you can go back into Schoolment and hit the big green accept button. This is what will cause their data to be passed from Schoolment to CSD Cares. So if the application has been submitted, but you're not seeing them at all, before you do anything else, go into Schoolment and make sure that their application has been accepted. If it has, again, it should come over overnight. So if you don't see them within a couple of days, start a ticket, give me the child's information. The vendor can do something that forces the system to send data when it isn't sending it automatically. There are a number of reasons why it doesn't happen. Sometimes it's not sure if it's a duplicate. They're trying not to create duplicates, issues like that. So once that's done, ideally, the information comes over into CSD Cares. So we actually have been referring to this entire ecosystem as CSD Cares, but that's also the name of our Salesforce-based web app that it is compiling all of our information for monitoring and reporting. So, well, not everything works the way that we want to. This system, this part, we call it the ERSEA module, but that just stands for eligibility, recruitment, selection, enrollment, and attendance. And those things are working. So the eligibility determination is working, enrollment is working, attendance is working. So it's not really an excuse anymore that it's a new system and it has bugs, so we can't put people in there. It does have bugs, but when you encounter them, let us know and we can work on eliminating them. Children other than CCAP only children should not be directly enrolled in CSD Cares. It doesn't make the same kind of file, and that does not communicate any information to CPS. So we need them to come through Schoolman. So the information should be passed automatically. And what happens when the information comes over is that it creates what we call program enrollment. So program enrollment is enrollment in a program option. So those are very broad. We used that language before in our old information system, but it means something a little different here. A program option is just an age group, a type of program at a location. So if you have a center, you might have a birth to three home visiting program option, um, and a prenatal program option. And you may also have a birth to three center-based program option. So none of those things say anything about funding. The home visiting kids could be early Head Start, they could be PI, the center-based kids could again they could be early Head Start. So it's not at this point enrolling them in any kind of funded program. It's just saying they are at this location and this is the service modality. So those are new every year. So to see your new ones, you would go into CSD Cares, go up to the top of the screen. You've got the little home picture in the upper left-hand corner and hit accounts. So, and then it will come up something that's probably pretty useless because it's a list of accounts that you've seen recently. So there's a little filter next to it. It says recently viewed. So what you should do then is click on the little triangle, choose sites, and then it will show you all the sites that you have access to. So then when you click on the name of the site, it'll take you to what we call the site account page, and you'll scroll down and you'll see the program options box. Every type of file in CSD Cares has its information rather than in tabs like a browser and like Copa did. It has its different pieces of information in what we call related boxes or related lists. So there's one for program options. You have to scroll down under the major information and then wait for it to load, unfortunately. So that list would look something like this. You can see there are several different types at this location, and they're across different years. So this is why the rollover is still necessary. The program option is a year specific, so everyone has to re-enroll for the new program year. The potentially very useful part about having it work this way is that um, we can have multiple years running at the same time. And it can tell the difference because you would have a program option in the 23-24 option. You have enrollment there. You will also have enrollment in the 24-25 option simultaneously. So that's why we had um, overlap this year. So we were able to put in classes and children and so on for a number of weeks before the year started. Some people were able to take very very good use of that time, and we did start the program here with several thousand children enrolled. Uh, Others are playing catch up because they didn't take advantage of that. So remember that next year. We'll start the program year in September again, almost certainly next year, but there is no reason to wait until September to enroll your kids for the new year. That can be done in July and August. So it's a good thing to take advantage of. It would make this time of year much less hectic. So each program option has an ID number. It's PO dash something. That's confusing for some people because if you're also involved in using the budgets and so on, when you get funding from the city, you get something called a PO number. That is not this. They're different. They look a lot alike, but they're not. So this was probably a poor naming convention for this object, but this is what we have now. Okay, so on this page, when you look at a specific program option, you'll see a list of program enrollments. So new ones have been created when the child's information comes from Schoolmint. And if you did the rollover piece and set the kids up to come over who were enrolled last year, when we went through and rolled them over in late August, that also created new program enrollments for the new year. Um, so this is the first step of enrolling them. Normally, you don't have to make a program enrollment. They come over automatically. I'm telling you about them because sometimes it doesn't work and you need to then create one, which actually isn't very difficult if you have the child's information. So if you have children who are returning from last year and they did not roll over, you need a new program enrollment. And on the program option page for the new one, so you make sure that you're looking at the right age group and year. So here for your birth to 3 program option for 24, 25, when you make sure you're on that screen, you can go up and hit the button that says new program enrollment, and then just put the child's name in. Because it's no longer prior to the program year, if you did this over the summer, it gave them a start date of September 2nd automatically. But if you put them in now, or hitting save, make sure to change the enrollment start date back to their first day of enrollment this year. Um, Otherwise, you can't put them in class before their enrollment date. So that's why you would do it that way. Um, so again, if you had a program enrollment with them last year, their name should just, when you search for them here, you should be able to find them and go ahead and enroll them. If you search for them and you can't, you will need to start a ticket and we can hunt them down for you. So as I said, that part should happen automatically, but often doesn't. Once the children have a program enrollment, though, I wouldn't consider them to be enrolled because they're not in PI yet. They're not in Head Start yet. They're they're just at they're just associated with a certain center. Okay, so before you do anything else, the system lets you do it out of order, but really it shouldn't. Before you do anything else, you need to decide what funding program they're in. So when the program enrollment was created, it will have automatically created applications to any program, funding program that you have for those children at that location. So if you have both preschool for all and Head Start at a center, and you enroll a 4-year-old, it's going to automatically generate those applications, unless it doesn't, right? But in most cases, it will have done this. So please, this is the most important step. I know everyone wants to put them in the class and hopefully take attendance. That's nice, but it's not this important. So we need to do this piece first. So how do you do that? So when you were given funded slots by the city, we put them in CSD Cares. They're so to access them and see what your funding is, you can go to the top of the screen, any screen really, in your view of CSD Cares, and click on the link that says Funding Program Allocations. Once again, and this causes trouble with the rollover, everything in CSD Cares and everything in Salesforce in general defaults to this recently viewed view. So we have a lot of people saying, I don't see my new funding programs. And sometimes we had a big list that was supposed to be imported, and most of them were created, but sometimes they're really missing. But most of the time when people can't see them, it's because they've never looked at them before, because they're new, and so they don't show up on the recently viewed screen. So my suggestion is to go to the screen, the funding program allocations, change that recently viewed to all, and then click on that little thumbtack icon to make it stick. So your default would be pinned, is what they call it, to all. So then you can see all of the funding program versions, um, and nothing is going to be missing from your view. Um, so that's how you can find the new ones to make sure you're doing. You really need to go to view all to get to um, the years attached, because the initial view here doesn't show you the year. So that what I'm saying with this slide, um, you could go to a site and also see just the specific funding program allocations associated with that site. But in that initial view, it doesn't tell you which year it is. One of the requests that I have going on with the developers is to make the old ones disappear, because right now, going into our third year, for every funding program type you have, you will see three of them on the list, because there was a 22, a 23, and a 24. So you need to make sure you're using the correct one. This be the new one. It's probably the biggest number. So when a child is enrolled, as I said, an application is created to every funding program. So from within that funding program, wherever you see it, if you click on the little link, it's got the FPA 1, 2, 3, 4, 5. It'll take you to that funding program allocation. And one of the related boxes on that page will show you every application to your funding program. And the applications have another little ID. Everything in CSD Cares has a little ID like this. In this case, it's A for application and then a number. So you need to submit an application in order to enroll the child in the funding program. So if all of their information is already there, this should be pretty simple. So for a new child, to evaluate whether a child is eligible, you need to look at their household income record. It has to be attached to the application. So if they don't have any income, it won't enroll them in a funded program. So if you look on the list, there should be on the application a line for household income, and it would say HHI 106825. Like is this one here. So it's an HHI number, and that's a specific record that it's tied to that will have income, family size, receipt of public assistance, housing status, all the things that determine eligibility to programs are summarized in that. For a child coming in from school, you don't have to create one. It will do that automatically. However, if you verify income, they come in, you look at their check stubs, you look at their benefits, whatever they have, and decide that the information that they put in the school mint was wrong, then you need to replace that one with a record that matches the records that you verified. So to do that, you go to the household. Hopefully on the application here, you see there's a household link. You can just click on the name of the household. It will take you to the household page. It'll tell you all the members and their address and so on. So like some of the other pages in CSD Cares, there are hidden menus. So in the upper right-hand corner of the family account page, there are, depending on your access, there will be different links that are visible, and the other ones will be in the pull-down menu. So you click on that little pointing down triangle, and there will be additional options at the household level. So you click on capture family or capture household income, and then there is a process that you'll walk through. You go through each screening. You hit next when it's done, and it asks you household size, do they receive benefits, what the income is, what type of income is, what the frequency of income, and you just answer the questions and hit next, and it will create one. And then you can go back to the application and replace that household income with the new HHI record. Because you just created it, this is where the recently viewed thing is nice. If you just created the new record and you go back to the application, when you hit the X to get rid of the old income. The new one that you created, right, will be on top because it's the most recent one you looked at. So that's where the recently viewed thing works for you. You don't, it does that reliably enough that if you do it in the right order, create it, and then go back, you don't even have to remember what the number is because it'll be on top. And you'll get an error message if you pick the wrong one. So don't overthink that part. Okay, once that's done, you can go up and submit application. And when you hit that, as everyone's about to tell me in the chat, you get an error message. You get the error message because you have to manually pick a categorical eligibility type. Um, so that is, in your judgment, why are they eligible for the program that you're enrolling them? So most of the time, this is low income. That just means their income is below the threshold of eligibility for this funding program, 400%, 100%, 200%, whatever it is. Um, Homeless and foster children are eligible for everything all the time. That's as a result of what's called the McKinney-Vento Homeless Education Act, which just says you can't turn homeless families away. So regardless of their income, you can take homeless families, and homeless is the categorical eligibility type. Now for PFA and PI programs, as I mentioned before, disability is also a categorical eligibility, so you can put child has special needs if that's the case. And in those cases, for PI eligibility, you don't need their income, you just need their IFSP, and that makes them eligible. For Head Start and Early Head Start, receives public assistance might be used. That means that families who receive TANF, SSI, and SNAP um, are presumed to be low income, and showing that information is enough to make them eligible. So the caveat here is that with the type that you select should agree with what's in the household income. So if you're putting that they're eligible because of SNAP, then that HHI record should have SNAP income in it and not just employment income. Okay. So hitting submit runs what's called a requirement check. It just compares the child's um, status with the eligibility requirements for whatever program that they're applying for. And so if they're eligible, it will add a check in the application where it says requirement check. So you'll be able to see that requirements were met and what date that was. Oh, I forgot one additional thing that I should have included in terms of eligibility, and that is address. So because the early childhood block grant is coming through the school district, in order to be eligible for the program, the family must have a Chicago address. So if the address is missing, they won't be eligible. And if they have an address in the suburbs, it won't be eligible. So that can be tricky with homeless families. You could use a number of things. If they've been at a shelter, you can use a shelter address, a relative's address, the center address, but they'll have to have something that says Chicago in order to be found eligible. So it's looking at the address field and not just the household income record. But once that's done, once you've been given a requirements met check, the children will show up on that funding program allocation page uh, under a section called eligible enrollees. And that means they have a program enrollment, they've been tested, they've have a requirement check, and they're fine. They're eligible. That doesn't necessarily mean they're enrolled still, though. You could go to that page and check all the boxes of the children who have been found eligible and who are attending, and then you would hit confirm changes, and that will make them enrolled. Annoyingly, that will make them enrolled as of today's date. So then you'll look down at the program enrollments related list on that funding program allocation page and change their enrollment date to whatever it really was. So the first day of school for most people was September 3rd. If they started last week, you put that date in. This is important to fix that date um, for uh, home visiting children, especially because when the system determines which time periods should have had a home visit and creates home visit records for you to fill out, it does so starting with their enrollment date and moving forward. So if you're enrolling a home visiting person, a home visiting child, um, make sure not to skip this step and set their enrollment date back to the beginning of the year before you do, or whenever they enrolled. If it wasn't the beginning of the year, but fix it before you do anything else, because you'll have the missing visit records otherwise. Okay, so the next thing, and I'm gonna stress this for a minute because we need everybody to do this, is what's called the ISB history. And if the name of that object isn't familiar to you, the content is, because for the last 2 years you've been reporting your PFA and PI children on a shared spreadsheet with us. This document actually has the information that we need to produce that automatically. So, as I said yesterday, for everyone who was at the meeting, we want to be able to produce that report from CSD Cares, and we don't want to have everyone have to also put their children on the ISB reporting forms, because that is a report that CSD Cares does run. It turns out a spreadsheet that's got all the same fields that were on the ones that we made you fill out. So if you put that information in here, you don't need to do that. But I don't have enough enrollment right now. So that's why yesterday I said next week, if we can't produce this report from CARES because the children aren't in here or they're not funded or they don't have history, then we're going to have to go back to doing it in a spreadsheet because we need to give them the information. CPS wants it, the governor wants it, the mayor wants it. We need to give them data. Um, so children need to have a current ISB history that reflects their current status. So most people need a new one every year. If a returning child, if it's their second year in PI and they're still with the same teacher that they were last year, they don't really need one because all the answers are going to be the same. Um, I'm not, as of right now, I'm not sure if it sticks, but you can try to change the class and teacher. But if that doesn't work, they need a new one. But children who used to be in PI and who are now in PFA definitely need a new ISB history because the questions, as I'll show you in a minute, are different. They have different fields that need to be filled out. So the system is checking how old they are and then creating a form for you to fill out that is not the same for everybody. Um, and also, as we're all vaguely aware, at least, the early childhood block grant funding is moving from the Illinois State Board of Education to the new Illinois Department of Early Learning, I think, early childhood. Yeah, early childhood, sure. So we next year or the year after, whenever that is completed, it won't make any sense to call it the ISB report. And this was another instance where we were not the best at naming conventions. So eventually we'll have to change its name, I guess, to the IDEC report. But it's ISB right now because that's who's getting it. Okay. So there's a two-step process for creating the history, which, yes, it's needlessly cumbersome, but there you have it. So on the contact record, For the child, you scroll down and down and down and down because this is almost at the bottom of the list. Um, and there's a related box that says ISB histories. So you check new to create one, and then there's some fields that you fill out, and you hit save, and now there's a record. It's mostly empty though. So you couldn't, when you were creating it, you couldn't see all of the items that needed to be filled in. So you look back at that related list and then click on the name. Now it will be there. There'll be an ISB history name, which is whatever you called it. It'll be a link and you will hit update ISB history. And so, like I said, it's going to be a specific history for the age group that you have. And it's going to ask specific questions. Please don't leave them blank because then CPS won't take the record. And yes, there's a couple exceptions. I'll get to those in a minute. So again, the PFA one is different than PI, but if you look at the subsections when you're updating these, you'll see they're called enrollment, demo, early childhood demographics, early childhood program, and then we've got the birth to three caregiver, birth to three indicator. These should be very familiar because those were the tabs on the spreadsheet. Because that spreadsheet is actually the report this is going to spit out, and it's got the required information for reporting. But there are some exceptions. There's a couple items that you'll see when you create the history, which will be the total number of hours spent in childcare and total number of parent sessions attended. It's September, right? So the number is one session and 100 hours, you know what I'm saying? So don't worry about those. We'll have to come back and get those at the end of the year. And I don't want people to just guess based on what it would be if the child was enrolled the whole time, because it's not really just the end of the year. If a child drops, you need to go in and fill those out, and you'll only report the hours they were actually served. That's the information that they're trying to get at with the question. If kids weren't enrolled all year, how long were they enrolled? Okay, so that's the ISB history. Um, we need it. So that's all I'm going to say about that. Again, the child is in the same class as last year. They're already on the report. It's not going to change. Um, but one of those things that hopefully is auto-generating at this point, but we'll have to see how that works, whether that works, is that the teacher has a ID number, like an Illinois State education ID number, that again needs to go to CPS. It's in addition to the child ID, if they don't have a qualified teacher with an ID number in their list of qualified teachers, they also don't count as enrolled. Just for the record. So if you don't have a qualified teacher in the PFA classroom, it's not really a PFA classroom. You need to get one and then put that teacher's ID on the form so that we can count them as enrolled. Okay, now that this is done, we can put the child in a class or caseload, which is where people rush to, but they skip the other steps and haven't been coming back around to them. And it's important to do those things because, like I said, we can produce the spreadsheets that we produce from CSD Cares, but they're pre-filtered. Only children enrolled in PFA and PI are on that list, right? Those come out in the report. So if you don't have the funding, they're not on the report. And so we need that to be done. We need the history to be done so that we can satisfy our funders and prove to them that we have children. Okay, having done that, so let's talk about groups and centers. Okay, so children in a home visiting program should be assigned to a caseload which is associated with their home visitor. All right, and there's a caseloads link right on your front page where you can create them. And children enrolled in a center-based program or enrolled in a class, there's a link at the top of the screen for classes. So that part is mostly obvious, but some people have tried to create classes for home visiting kids. it doesn't really work because the information we're trying to get isn't really attendance, it's how many visits were made. So it's a different kind of a different way of record keeping. Okay, so to add children to a caseload, first you need a caseload. So a caseload, as I said, is associated with a home visitor. So once they're in, they have a contact record with the role of home visitor. You can go you can go into their file, into their contact record, and just go to where it says case loads and hit new. If your contact for your home visitor isn't in the system right now, that's beyond what I can talk about in this session, which is already running long, but we will be doing one in a few weeks that will cover that. But in the meantime, you can look in the knowledge base, and there are instructions to create a new teacher contact in there. So you need, just like the funding enrollments and the program enrollments, a caseload needs to be created every year. And again, that's because the years can overlap. And the caseload is going to be connected to this year's funding allocation as well. So the interesting thing about this is this proves that Salesforce can do what we want it to do. Because in this case, rather than giving a opaque number that nobody knows what it means, you have to write it down or look it up. Um, uh, Case loads are named by the system in a way that is actually logical. So to create one, again, you hit new. It'll ask you a name and it will ignore you and assign one anyway, which in this case is a good thing. And then you want to identify the home visitor, and you will look for the funding program version. So if it's Prevention Initiative Home, that's the one you need to pick from the menu. This is Caseloads are associated with funding because the different funding sources have different requirements, so you can't have a blended caseload. So a caseload is going to be all PI or all early Head Start, and that's because the group size is different and the visit frequency is different. So blending them would not work. So you check the time period. You can create one for current year right now. If you're doing this in the summer, you can create one for the current year, or for the next program year, you can create those two in advance. So when you save it, whatever you named it, it will change the name to teacher name, funding program version, time period. So in this case, the practice one I did, it's Jane Doe Early Head Start Home 2024 to 2025. They're all called that. That is useful. You can tell which one you're supposed to be using, what the funding source is, and what time it is. So that makes them easy to search for once. So then to assign the child to the caseload, again, you can't have skipped the step where you added funding because then there's nowhere to do this. So the child has to have the funding program enrollment of the same program as the caseload. So in my case here, to put the child in the early Head Start home-based caseload, the child has to have an early Head Start home-based funding enrollment. Um, And that's important because that's where you're going to add them to the caseload. So it's not on their record, it's in their enrollment. So if you go to the current funding program enrollment record, the one that says this child is enrolled in PI this year, and it has a little FPE number associated with it, then you could add the caseload to where it says caseloads. So once you've done that, once you attach the child to the caseload, um, the system is automatically going to generate blank home visiting records to fill in. So starting from your enrollment date based on the funding program you have, weekly for early Head Start, bi-weekly for PI, it's going to create the first one, the second one, the third one. And it will just give the broad time period, the week or 2 week period when it would occur. So when you actually make a home visit, you just click on that specific one and then you put the actual date in the record. Okay, so for center-based children, you need to create a new class for the new program year. You can't change the dates on the old class and use it again. You have to create a new one. Again, that's because they can overlap. And the new class has to be associated with this year's program option. So you can still associate them with the same room. No, you don't need a new room every year. You don't need a new schedule every year. But you need to have the correct program option and time period attached. So this can be done prior to rollover. As soon as we created the new program options, we created these back in May. In most cases, so classes can be created at that time. Um, so depending on your access, it seems kind of random who can do it or who can't. Sometimes you have to add a whole new one. There is a copy or clone feature. But if you're making a copy, you don't want to use the old program option. You still need to X out of that and then make sure to use the current year option to attach to the site. And again, the room can stay the same from year to year. So then we need to add a schedule. You can use the same schedule. You should use the same schedule as you did last year, probably. But you can use the same schedule for every class at a site, but I don't recommend that. And the reason for that is that the schedule is where you close the class if you're not in service. So nobody counts as present or absent. The classroom's closed. But if you're using the same schedule for the whole site, all you can do is shut down the whole site. You can't shut down the class. And normally that was fine because that's what we did. Right? The class is closed for holidays, or if there was an emergency and the heat was out or whatever, the whole center was closed. So we just mark it as closed. But what we've been doing these past 4 or 5 years now is having one class at a time closed because somebody had COVID. So there hasn't been a way to just mark only that class as closed, unless you have it their own schedule. Because it's from within the schedule, you go to what's called schedule exception and just put in the date the class is closed. Okay. So once children are enrolled, you should be able to document attendance. You click on the classes tab to find your list. Again, you won't see them all. It's filtered to recently viewed. So if you're not the person who added them, you haven't viewed them yet, so you go in, you only see the old ones. So again, you change that to all, you see all the classes, and you'll use the current year's classes. What I do when I help people create classes is I put the year in the name. So instead of just butterflies, I say butterflies 24, 25. That's just so that you can look at the list and you can see that that's the right one and not 23, 24. Again, I'm asking the vendors who are working on developing the site if they can hide last year after a certain point so you can only see your current classes unless you unfilter and look for them, but so far they haven't done that. And that right now there's only 3 years. It's not that difficult to find the right one, but we used COPA for 15 years. And nobody wants to have a list of 15 versions of the same class. So hopefully we'll be able to work with them and get that accomplished. So you have to take attendance every day. I've run reports. Pretty much nobody is doing this. I mean, people are taking attendance, but when you get an attendance report out of here, there's 3 categories. There's not taken, absent, and present. And not taken outnumbers everything every time I look. So we just go in there and take attendance. Um, the first thing I say about that is because right now we're still getting enrolled, but the year has already started. We're talking about backdating attendance. So be aware if you put a child in the classroom today and give them the start date of September 3rd, you're not going to be able to take attendance before today yet. So if you do that and then you go back and look at last week, they're not on the list. This is one of the things that resets overnight. So if you come in tomorrow and look at it, you should now see them in the classroom going back to their start date. But it's not instant. Um, we are asking that people take not just regular present or absent attendance, but please put in the meal counts. Um, we report on that. We compile those numbers for the parent policy committee, and we would like those to be more accurate than they are. So please put those meals in, and then we won't be harassing you and asking you to use the Survey Monkey form to report them because we can run a report out of here and just see. But as long as it's not being done, we have to use other methods because we're legally required to make that report every month. Okay, that's what I just said. Provide a complete attendance by 10 o'clock in the morning. This is because for policy, if there are unexcused absences, that means some of the kids are no call, no show. You need to, and they haven't turned up by 10 o'clock, you need to follow up with the parent to make sure they're safe and keep a record to make sure that people know that that happened. Okay. So if a class is not open, this is what I was talking about a little bit earlier, you need to close it so that nobody is present or absent or not taken. It's just not a class day. So that includes holidays and scheduled breaks, but also unexpected incidents. So that would be COVID, that would be a snow day, be the air conditioning is out and it's 100 degrees, that kind of thing. So to close a class, what you do is create a schedule exception. This will apply to all classes that are using the same schedule. So on each class page, one of the things you had to add when you created it was a schedule. So you click on that, the name of that. This is not a real one. So this one we just call full time. Um, and it'll take you to the schedule page. And just like all the other pages, it's got a bunch of these little boxes that they call related lists. So you go to the schedule exception, you click new, you give it a name, and then you put in the type of closure. It's not today's date, it's the date it's closed. Because what we're doing is we're turning off the attendance module for that day. So some of these you can put in now. My example here is Thanksgiving. You know you're not going to be open then. You're not going to be open on Christmas. So you can practice this by just going into all the schedules and making a schedule exception and say, wait, there's no class that day. And then when that day comes, nobody's absent or present. Okay, the last bit here to drop a child. Um, it's not a specific drop function. Everyone's enrollment, because it's year to year, everyone's enrollment in the system is time limited. So they have a start date and an end date. And the default, if you put kids in at the beginning of this year, the default is you had a start date of September 2nd. No, that was a holiday. They probably started September 3rd, but they had a start date and then the end date was September 1st, 2025. And it just assumes they're going to be in there for a year. Um, and so they will all be dropped automatically at the end of the year. So if a child leaves the program before that, all you do is you go into their records and you change the end date. The only problem is that, as we've just gone over, they have several different kinds of enrollment, right? They're in a they're in a group or they're in a class, they're in a program option, and they're in a funding program. So you want to do this in this order. Drop them from the class first, then drop their funding, then drop them from the program enrollment. And the reason for that is if you once you drop them from the program enrollment, you can't edit those other fields anymore because you can't have a funding program enrollment or edit one unless you have the right kind of program enrollment. So that basic enrollment comes last. You drop them from the class first. Now, if you're ending the enrollment because the child never enrolled, so it's an erroneous enrollment, like maybe they were in the wrong program, maybe they're the wrong age, maybe they came over from schoolment because you accepted an offer, but then they never showed up. The way you take them out, we don't just want to drop them, we want them not to count as enrolled. So what we do is you change the end date to be the same date as the start date, and then you hit save. And then you have to edit again and just check the box that says invalid enrollment and then submit that again. And what that does is it means they never had an active enrollment. So if you run a comprehensive list of who was there all year, they won't be there. Okay. One more note on that I guess I should have mentioned here. I did a little, but it was a long time ago because this is a long webinar. Um, Dropping a child from CSD Cares does not drop them from schoolmate. The information from schoolmate comes one way. It comes out of schoolmate and into CSD Cares, and nothing ever goes the other way. So once you've dropped the child from CSD Cares, you also need to go into schoolmate and decline the offer. Okay. Again, that's for this year. We're working on bringing out this new uh, enrollment system to replace schoolmate next year. And we have already talked to them about this. If at all possible, we'd like to communicate in the other direction so that when you drop someone in cares, it will drop them from schoolmate overnight and you don't have to do anything additional. But we're not there yet. So we're in a new phase this year. It's different than we were all through last year. We were still building the plane while we were flying it. But the plane is done. We are still working on training. We're working on reporting capacity, but the system is actually here. So what we expect this year is that you will enroll them. You will roll in the system. You'll take attendance every day for center-based programs. You will look in the knowledge base out of your own volition and see what is going on. Try watching the trainings and working through those, and read the CSD Cares updates or the CSD updates that we send out twice a week because we'll have new information, upcoming trainings and opportunities and so on. And then if you can't, if you're trying to get the children in and you run into an error, you run into a problem, start a ticket. I've been saying that for weeks, so just let me say this so everybody understands. There's been a good response to that, and I'm very happy to see it. It's great. We've had over 1,500 tickets. Yes, there's about 100 of them that we haven't responded to yet. Um, there's only on my team, there's only 4 of us, and then a lot of issues we can't do, so we have to forward them around. So I can't really promise that it's instantaneous just because of the load. Um, so here's what you can do to get a response to the ticket faster. Okay, when you're saying a ticket, if you submit a ticket and it just says like, I can't find my children from last year, then we're going to get to that, and then we're going to send you a message back, as you can in the new system, you can communicate back and forth within an open ticket. We're going to send a message back and say, which children, what class are they supposed to be in, what are their names, what are their dates of birth. So just do that in the first place, instead of saying I can't get my kids enrolled, say I can't get John Smith's birthday 2/21/22 enrolled in the Little Tikes classroom. Giving us more information means that we can process it quicker. We don't have to come back to you. We can tell right away whether the file is even there or not. So it makes it a lot easier. So the more information you put in there, the easier it is to address. However, if you gave us a list of 45 children to enroll, um, it's going to take a couple days. It just is. Okay. So I just want to come back again before it started. The digital hub is actually gone now. I mean, it's still there, but it's not updated. We have a new knowledge base. It's in service now, which is the same place as the ticket system. It's got all kinds of fun stuff. So I just screenshotted this earlier today. Got the different training materials open. In most cases, they have under these categories, there will be paper guidance, like a PDF form, the training materials. There will be videos of people demonstrating how to do certain things. They're really brief. I'm talking about like 2 minute, 2 minute videos just showing you how to access this or access that. And then what they call at your own pace training modules, where you click through from time to time and go advance from one screen to another, and they walk you through the uh, subject matter. So those are good opportunities. Um, if you can see from here, we've got case management, we've got human resources, addition to enrollment, um, professional development portal. So take advantage of this. Again, it's the same app. So if you need help, start a ticket. When you log in, it'll give you a choice between knowledge and get help. Get help is the ticket system. It doesn't say ticket, it says get help, but that's what we're talking about. Okay. Okay. So I'm just looking at your questions now. I'm going to review these. So some of these I'll have to follow up on. I see people are asking about class size. At the moment, so the question is, we have classes are only set up for 8, but we need more. At the moment, the program options are set up so that a class has to be within a program option, and that comes with a class size. We will have to meet with the developers and talk about that. That is a good point, because now that we brought CCAP in, there are uh, more variations here. Let's see. Someone's saying I didn't register, came in late. Can you come in? Yeah. So we are sending out the announcements as part of the CST updates. Those usually come out Monday and Wednesday. Um, but put your information in the chat here. We're going to save that. I'll make sure that you get things because we will be posting this from the beginning. We recorded it; it's still being recorded, so we're gonna hopefully trim it down a little bit, then post it on our YouTube page. I'm a YouTube creator now. My kid would be so impressed. Um, and then I'm gonna PDF and send out the whole presentation here as soon as I edit it because I saw it twice. I didn't change where it talked about the digital hub to the knowledge base. But more importantly, I want to stick that road to access page in here. So when we send this out, you'll have the QR codes with the URLs to take you to the different ways of starting a ticket and requesting access. So I feel like we covered that, but that should be in here, so I'm going to add it. and then send this to everybody who's here. Um, some people are aware. Oh, good. Oh, good. I'm so happy. Um, a question from Loop Learning. I tried to create a new program in enrollment under the program option tab, and it was the error message that said related site has other funding program allocation. Um, So we a lot of people have had that, but not everyone. We don't know why it's occurring at some sites and not others. But what the lead developer earlier today asked me if we had an example of a site where that was still occurring. So I can give her your information. Not here in the chat where everyone can see it, but you can send me an email with the child's name. I can give it to the developer and we can try to make that work. Or find out what's wrong because it's strange. Let me see. Confirming you'll send these slides. Yes, I'm going to send these slides out. Um, I just want to edit them and put the road to access in it so I can make sure that everyone who saw this has that somewhere. Okay. If we accidentally decline a student on schoolment, how do we later accept? Um, I don't love the way Schoolman is set up because I don't want to make extra work for myself. As far as I know, the only person at DFSS even who can restore an offer that has been declined after 24 hours, if you decline them and then immediately know that you shouldn't have declined them, there is an undecline button, but that will disappear overnight. So if you don't figure out that you declined them by mistake until the next day, send me their information because I'm the only person who can undo it, sadly. Okay. Uh, the household income is 400%. What categorical eligibility type can we choose from? There, well, if it's just under 400%, that's still, we would call low income means they're under whatever the limit is for that program, funding program. But if they're over 400%, it has been so long, I don't have to check. So that would be what we would call a private pay case because they're not going to be covered by any public funding source unless they're enrolled in PFA or PI because they have a disability, in which case its child has special needs. But if it's not it, if they're private pay, I haven't seen one of those in so long. I don't know that we put it in there. So I'll have to get back to you on that one. Okay. Okay. Someone asked for the hotline number. I should have put that in the presentation. Maybe I'll add that too. But if you go to the website, chicagoearlylearning.org, it's in the upper left-hand corner. It's the 866 number. Um, and that also is question, completing the Schoolman application and found out that the child already has a application or an account, but the parent doesn't have access. Again, you need to call the hotline for that issue. Yeah, and you might also send that to the data team. There are cases when we can figure out how to get you access, but not always. But we can try. But send us the child's name, and we'll look them up and see if there's a way we can get in there. Okay. Okay, so like, oh, okay. Here's one. Um, Prenatal participants need to have their own program funding under prenatal. They actually don't because they're eligible for the home visiting programs. They have, it is a strange case though. They have a different program option, but it's associated with the same home visiting funding sources. So a lot of people have struggled to put in the prenatal enrollments. So what I have to say about that is that that is something that is very difficult to backdate. So for prenatal enrollments, you really need to put them in when they enroll, because the system isn't actually asking you which application to give you. So when you create a child, it decides on the application based on the birth date. So when you're putting in a prenatal application, you're going to put in the due date, which is the future. And if it has a date that's in the future, then Schoolmint will show you the prenatal application and it will show you prenatal programs. But if you have the date that's in the past, it's only going to show you center-based programs. The problem that came up last year is that people went in to put in their prenatal enrollments months later, and the child had already been born. So then they put in a date, and it was in the past, and so it wouldn't show them the prenatal application. It showed them the birth to three uh, applications. So you need to get your pregnant moms in the system before the baby is born. And if not, if you haven't done that, then what you need to do is create the initial application with tomorrow as the birth date, so they're still prenatal, and then change the birth date to correct it once you get in the application, because it's based on their birth date. Um, Also, back to the error messages that have occurred with many children. Should we send a ticket for every child? Really create one ticket and just list all the children. And then I'm going to forward the whole thing to the developer. So if you could put that in there this afternoon, I'll escalate it before I leave. That'd be great. Um, so And the funding program allocation management screen, it says I have 18 slots to fill, but only gave me 3 names. What next? So the applications for the other children haven't been submitted. You would go in and hit submit, and then if they have a requirement check, they'll be added to that list. The reason you come in and you see some names already is your eligibility is actually good for more than 1 year. So if you're returning to the same program you were in last year, it's still going to come in and generate an application, but you don't actually have to submit it because if it's their second year in PI, say, they have a requirement check from last year that said they were determined to be eligible, and it's good for 2 years. So when you go to the funding program allocation page, their name already appears as eligible enrollees, and all you have to do is check the box and move them down. You don't actually have to submit their application the second year because they're still in their eligibility period. It's only if you didn't submit them last year that you have to submit them now. So you would come in and you'll see some of the names on the list already just because they're already eligible. Um, but the new kids won't be on that list until you go into their individual funding program applications and submit them. Okay. How do we move a child from one classroom to the next? These are good questions today. You have to drop them from the first classroom. You don't need to drop them from the program, though, or their funding sources. You just end their class enrollment, um, and then you start their class enrollment the next day at the new class. As long as they don't overlap, it shouldn't give you an error message. The downside of that is that if you start out and you put the children in the wrong class, you have to drop them the same day and start them the next day. So you're going to miss the ability to take attendance for the first day of enrollment. Except if they started this year at the beginning of the year, because we did something clever and we started the year on a holiday. So the first day, the automatically created start date for everybody starting at the beginning of the year is September 2nd. So if you started out the year and put them in the wrong class, you can use the start date of September 2nd, the end date of September 2nd, and then put them in the right class with the start date of September 3rd, and you can still take attendance. So you can edit both the start and end date. So later during the year, what you want to do is if you've accidentally put them in the wrong class, is give them both the start and end date that are the day before they started, so you can still use the real start date as the enrollment date. I say that's also how you move them back and forth. You want to drop them the day before they show up in the new class so that you can give them the start date the next day. That's different than it was in COPA. If you use COPA, you were not present on your drop date. So you would drop people the day after their last day of class, and then you could put them in a new class starting with that date. So you just have to use the earlier date now. Okay. Yeah, we got more error message. So we're going to follow up on the error message. Um, It's a pain now that I have a couple sites that I see that it's still occurring at. I'll follow up with a developer today. Let her know. Uh, like it. I see a couple names in here, so I'll follow up with her on those. Okay, a lot of good questions here. Next time we do something like this, I think I'll incorporate some of this material. Glad to see everyone was paying attention. Um, all right. So I don't want to keep you too much longer. It is Friday afternoon. Um, so if you have other issues or you're trying to do some of these things and running into problems, go ahead and start a ticket, or you can drop me a line this afternoon. But I was off site yesterday and doing a lot of specific work today, including this presentation. So I know I have a giant backlog of email. So I would right now, I would definitely urge you to start a ServiceNow ticket because those are being distributed among like 6 or 8 people. So you don't have to wait for me. Okay. So thank you very much for taking part. I feel like the attendance was strong. I hope to get this posted next week. And as soon as I make a couple changes to this PowerPoint, I will send it out to the whole world. Um, for people, well, yeah, but so you should be getting all this information in CST updates. If you don't, let basically anyone at the department know that you're not receiving them and need to, and we will forward them and make sure you're added to the list. Okay, and do read those. There's some interesting stuff in there. So thanks, everybody. Have a great weekend.